My name is Andrew Sprague, and today I will be presenting on the use of telepractice for individuals with autism spectrum disorder, or ASD. Starting off with a definition. So telepractice goes by a variety of names. You may have heard it referred to as telepractice, or telehealth, telemedicine, or teletherapy, and even some other names as well. For today's presentation, I will be using the term telepractice, as this is what the American Speech Language Hearing Association, or ASHA, which is the professional organization for speech language pathologists and audiologists, has adopted as their term for this type of technology and delivery of service. So telepractice is defined by ASHA as the application of telecommunications technology to the delivery of speech language pathology and audiology professional services at a distance by linking clinician to client or clinician to clinician for assessment, intervention, and or consultation. This definition can be applied to a variety of medical health professionals, not just speech language pathologists and audiologists. It can also be used by primary care physicians, mental health services, just to name a few. And as we've seen in the past year, schools are able to use this technology as well to continue providing services. So the history of telepractice. Research initially began on telepractice in the 1980s. Early forms of telepractice looked like simple phone calls between clinicians and their clients. In the 1990s was when states began to invest in that research. And in 1993, the American Telemedicine Association was established, which is a professional organization that encourages the use of telepractice. In 2005 was when ASHA, the Speech Language Pathology Professional Organization, officially recognized telepractice as an appropriate model of service delivery for speech language pathology services. In 2020, as many of us know, in the wake of the COVID-19 pandemic, was when telepractice really began to gain attention and be used widely. This was because we were no longer able to see those health professionals and receive those services face-to-face. Having a form of technology to continue receiving those services is really important for a variety of individuals, but especially individuals with autism spectrum disorder. Many of them receive many services that would not be available to them when they lost access to things such as school or just being able to see people face to face. Using telepractice allowed them to still get those interactions as well as those important services, therapy services or medical services that they receive. Looking at the parent's perspective of telepractice for individuals with ASD, the parent's perspective is really important. Parents are such a key component, as well as caregivers, in providing teletherapy services or telepractice services. For many individuals, they need a parent or caregiver sitting next to them, helping them navigate the computer and just helping them maintain their focus on the medical professional who's on the other side. In 2020, Marina et al. Did a study where they implemented applied behavior analysis treatments, both virtually and in person, and they then compared the outcomes and perspectives of clients and caregivers on that experience. The participants, particularly the parents and caregivers, reported that they enjoyed having the flexibility, lack of travel time, and they really enjoyed the engagement involved in telepractice, which is the engagement between the parent and caregiver and the child. It concluded that research supports the use of telepractice in treatment of individuals with ASD, as well as that it promotes those caregiver-parent relationships with the child. Looking at the research for treatment use of telepractice, so in 2010, Boisvert et al. Compared the current studies that had been published into the literature. So at the time, there were 8 studies with 46 participants that looked specifically at using telepractice to provide treatment for individuals with autism. Of those 8 studies, 7 of them revealed positive outcomes, with many parents reporting again that positive change in their relationship with their child. It was concluded that the use of telepractice is promising, but that there is more research needed. In 2010, Sutherland et al. Completed a very similar study with the research that had been done since 2010. So in that 8-year period, there were 14 studies with 284 participants that had largely positive outcomes. The conclusion was that services appear equal to in-person, but again, there's more research needed to decide if that is truly beneficial. Looking at using telepractice for diagnosing individuals with autism. In 2020, Alfaridin et al. Compared all the current studies that had been done on the use of telepractice for diagnosing individuals with autism. There were 10 studies at the time with 997 participants. The benefit that they found is that it provided naturalistic settings, so individuals with autism were able to be assessed in their day-to-day settings rather than a scary clinical setting that may change their behavior or the way they're acting. It provided more opportunities for collaboration, and also there was a quicker time of diagnosis. Another benefit that was found was that the time that it took to receive that diagnosis or the assessment process was a lot quicker because individuals weren't having to see multiple professionals throughout the day. Rather, again, that collaboration was able to happen right there. All the professionals were able to be on the call at one time. So, why use telepractice? There are many evidence based treatments for students with autism, but there's often a lack of professionals to provide those treatments, as well as a lack of access to those professionals. So, the benefits of telepractice is that it provides access to trained professionals to rural communities. It eliminates the travel time to go receive those services, provides a naturalistic environment so individuals can be diagnosed or treated in their natural environment, and it also allows for continued intervention during times of emergency as the pandemic or a natural disaster. So, as I mentioned earlier, that continued intervention is so important for individuals with autism because many of those services they wouldn't have been able to continue receiving if it weren't for telepractice. So, what does all of this research mean? The evidence currently points to the benefits of using telepractice for students with autism. However, further research is needed to determine if it is a true equivalent of in person services. So, although we know it's beneficial, the research that needs to be done is to know if it is as equally beneficial as in person services. My take home component is providing some tips to help provide your child or student with a positive telepractice experience. So, the first step is to utilize a quiet and distraction free environment so that they can truly focus on that other person within the computer. The second is to utilize activities and materials that maximize interactions so that they're not just sitting there, they're being interacted with, as well as interacting with whoever is sitting there with them, so the parent or caregiver. The third tip is to incorporate the natural environment and frequent communication partners. So, again, incorporating the parent or caregiver that's sitting next to them, as well as incorporating things in their natural environment because that's where they spend a lot of their time. I also included a couple of links for activity resources, activities that can be used on teletherapy or just at home as well. And I created all this information into a bookmark, which is on the side here. And those are my references. Thank you.